way. But the real question is, are industries taking accountability for their actions? And what exactly are our governments doing to prevent these numbers from increasing? I think that this is something that needs to be highlighted at a larger platform.
To my knowledge, Dr. Fernandez, the problem is exactly this, that there is no focus on primary prevention. There is a focus just on the treatment of cancer. But if you go at European level, you find discussion at top level with the involvement of the DG Santé, Directorate General for Health of the European Commission, with a member of the European Parliament and national delegations. The focus is always on granting access to more and more people to pharmacological treatments. There's no focus on primary prevention, so people cannot become sick, not be affected by cancer, especially in pediatric age. The focus on primary prevention is something that, if not addressed, will not allow us to win this fight against cancer, because you cannot imagine to win a fight if you do not reduce the number of people that are involved year after year, and that are always increasing both in adults and in childhood. Cancer is, according to the National Cancer Registry data in Italy, the ITOM Association, is and has become the first cause of death due to disease in pediatric age in Italy, as well as in Europe. So these are figures that are unacceptable, but do not find a proper answer in the institutional commitment for primary prevention. The only thing that we can hope, as Maria Neira told this morning, the commitment of WHO towards the policies of zero pollution and on climate, so mitigating the emissions that we are producing, comes exactly from there. That everything that reduces emissions that is a threat for the environment is also a threat for health. Is something that we have to foster. So just if we succeed in reducing the emissions coming from burning of fossils, which is now made more complicated by the international situation, we can address this issue. And I know that there is a big effort from the cancer registries. I thank the colleague from the cancer registry of Catania and Messina. They make a big effort, but at the end we should stop just counting the number of new cases of cancer. We should do something with this information to prevent more cases to surge. So this is exactly the topic that you addressed, and my answer is that there is not enough effort, if any, in doing something for preventing these numbers.
Thank you. I think that definitely design the cities also for new generation and think of the safety of new generation is very important. And for that, I suggest to maybe go to the next speaker that will talk of something that can be related to that, like a vision for 2030. So I kindly ask the chairs to introduce the next speaker.
Okay, our next speaker is Francisco Guachalla. He will be presenting on embracing the SDG-2030 for monitoring and learning in emergency and developing projects. Take it away, Guachalla.
Thank you very much, Dr. Fernandez, and thank you for all the team that invite me to do this, to be part of the conference. I want to share with you a PowerPoint presentation, a very short Excel sheet. I will share my screen with you now. And I hope you can see that.
We can see it.
Okay, great. Well, I've been working with development and disasters for about 30 years. Now I am teaching at the university, and I was wondering, what are those goals we could achieve in order to support all this work needed to achieve those SDGs, the Sustainable Development Goals by 2030. I think the professionals should use indicators of the SDGs and the resilience in their daily work. I think it's possible. Project planning, monitoring, and learning methods should incorporate the SDGs and resilience matrix. And the SDGs indexes, targets, and indicators should be part of the curriculum at the universities and in general education as well, primary and secondary. What we are doing at the university level, we are teaching students to be familiar with the SDGs and with the metrics of the SDGs in order to see how they can use them later in their professional career. We use a very nice method from Finland, from the city of Espoo, where the students organizing groups can choose a few SDGs which are important for their careers, and they locate us in this matrix, which is organized by location and programmatic sector, and then they find the targets and indicators of those SDGs and find and calculate the difference which has to be achieved until 2030. For the resilience indicators, we follow the recommendations of the Sendai framework of disasters risk reduction, published in 2015, where they recommend to strengthen the preparedness, the response, and the early recovery capacities of the communities at local level. And finally, for the project monitoring, we teach the students to exercise according to this systematization curve, which we published already in 2005 after 10 years of working with communities and development projects, where we show the students that the advance from baseline towards a target is not linear, like sometimes we professionals think. It's rather more like this blue and red curve, where we need to discuss with different stakeholders what indicators need to be adjusted in order to achieve the goals of the project. And following this idea, we organized this outcome mapping of the log frame 3, where we have in the trunk the most important target population. In our example, which we've been working for several years, we have WASH projects, water sanitation and hygiene projects, to improve the infant mortality of children. In the trunk, we have that target population, but we need to work also with other populations which are also target for the project at the outcome level, and those maybe the water committees, the school teachers and families, so that we measure indicators of process indicators of activities at the low level, and product indicators for the outputs, and change indicators at the outcome level, and impact indicator at the specific objective. How do we do that? I will finish the PowerPoint presentation here, and I will continue with a sheet of Excel. I don't know if you can see that now. Yeah, all right. This is a very simple method. There are several planning tools like the timetable, the budget, the log frame, the scope of the project, etc. But what do we do with that information is that we collect the information of the target population here at the top of the sheet, and in the bottom of the first part of the monitoring sheet, we have the different levels of indicators for activities, process indicators for outputs, the products, and the change indicator for the outcomes, which I consider very important for the development projects. What we do with this information of targets, we measure the advances towards those targets along a period of 1 year, so that the students can exercise and simulate the advances of those indicators and see how those advances improve towards the targets. And that is very much related with the matrix of the SDGs, because they have also a similar traffic light qualification of those advances of indicators. By the end of the year, they try to reach the level of the targets as we have seen in the systematization curve. And then we explain the students about the executive report, where you have the results of those indicators and the curves, which explain much better and much easier how those improvements have been going through the year. They can repeat this for the 3 or 5 years of their projects. Here the point is that I've seen the importance that everyone could support the work for the SDGs, because I think in our countries we are not advancing that much. Governments are reporting for annually for the global report, but we may be reporting averages for the whole country, which may be leaving important sectors of girls, of rural people, and of poor quantiles of the population. So it would be important if we professionals could be part of this process as well in our projects. So what I am doing with the monitoring system is I am showing the students that they can introduce in this monitoring system the SDG indicators. For example, here in this WASH project, we have included the first indicator of the SDG 6, which says that every family should have access to the water services. And they can do the same monitoring of this indicator. I will show you first, before I go through, that we have introduced also another indicator for resilience, because the teachers at the schools, they could start teaching about some practices that scholars could practice in the school and repeat in their families, in their homes, right? And we can monitor these indicators in the same way and see if they are achieved at the end of the year. But if they don't achieve what we have here at the end, and we can see in the executive report, you can see if we, for example, here they didn't achieve 450 families at the end, and they only achieve that work with 100 families, they will change automatically and show the rest of the stakeholders where the indicator needs to be adjusted. And the executive report reflects this situation as well. That's the way how we have been trying to teach the students to use these indicators, showing that it's not difficult, it's easy to use, and we can be part of the advance of the SDGs at the low level, what's important for the principle of the Agenda 2030, which says leave no one behind. We have been leaving behind probably many girls, many rural people, many poor people of the lowest quintile. Okay, that's our presentation. I would be glad to respond to some of your questions if you have some. Thank you very much.
Thank you, Francisco. Thank you for your presentation. And I asked Domenico if we have the last presentation, and then we make another discussion on that.
I have tried to fix the presentation to the time period you gave me. This method follows a certain model we have been practicing with communities or local people, municipalities along 10 years, 15 years, and we practice that in the Philippines.
Just 1 second, colleagues, that we have one problem with the connection. So Francisco, just 1 moment, please, because we lost you part of your presentation. So
I am sorry about that. Do you have?
Can you put on the last slide of your presentation?
Just 1 moment, that we are solving this technical issue.
If I can put the last Excel sheet, I do that
just
now.
Just 1 moment.
Okay, you can see that.
Yes, the one of the report, yeah.
Yes. Is there any question you want me to explain?
Francisco, just 1 moment, please, that we have some technical issues. So stop 1 moment.
You put it on the screen?
Yeah, actually, our connection in
and
the
go through
room,
the results.
Yeah, actually, the connection in the room dropped down, so we have to restore the connection and like continue and finish with Francisco. So sorry for the technical glitch.
I'm sorry about that, but if you want, you can do the presentation by your side, and I can explain what needs to be
No, it's not the problem. We can see your screen, and I can see the screen. The problem is that the connection in the room and the big screen, we can say, dropped down. So I can just see you, but not the people in the audience.
Ah, okay.
Just 1 moment.
Let's wait a little bit until we can respond to questions they may have.
Okay. So just 1 moment. We are a bit late. So we saw that also the keynote speaker of the next session is gonna leave us soon. So I propose like this, if the chairs are okay, we can hold on 1 moment with the presentation, and we can anticipate the keynote speak of the next session.
Okay, thank you. Should I go back to my presentation? Is that okay with the rest?
Yes, I think you should go back to your presentation.
All right, okay. Do you want me to summarize the last slides, or I won't go through the whole presentation again, right? It's too much time.
I think you can present the most relevant parts.
Okay, let me share my screen, but first of all, okay. I have to go back a little bit. Yeah. Okay. Good afternoon again. I'm sorry about this inconvenience. I will summarize a couple of slides. first of all, we want to teach students who are going to be in the practice with local governments, local communities in the future, the way how they can manage some SDG indicators, and if it's possible, resilience indicators as well, because resilience is very much a part of the SDGs. What we are doing, we are using a method of the city of Espoo of Finland. Finland, as you know, in the last 2022 global report of the SDGs is the #1. So I think we are following a good example how to influence, how to make aware the young population about the importance of the SDGs. So what they do, they organize groups of 5, 6 students, and they choose a number of SDGs which are most important for them, and they locate those SDGs in this matrix which you are seeing in the screen, and that goes by location. It can be local, regional, or national location, even continental, and by programmatic sectors. Once they do this, they find the targets and the indicators of those SDGs and calculate the difference between target and indicator in order to see what needs to be done until 2030. And they come up with some proposals, what they would be doing when they start working at the local level. For resilience, we follow the Sendai framework for disaster risk reduction, which recommends to strengthening the local resilience by strengthening preparedness, response, and early recovery. So we've been working with UNICEF from 2011, 2014 on this kind of project. And we have certain indicators which we share with the students so that they can also use them in their project monitoring system. And for the project monitoring system, we follow this systematization curve, which we have published already in 2005, and we have been using it later in different projects in the Philippines, in Sierra Leone during the Ebola emergency. For making clear to the students the need of monitoring process indicators for activities, product indicators for outputs, and change indicators for outcomes, we work with them on outcome mapping for the log frame 3, which is mainly the track related with the main target population. For example, in our case, we work at WASH project, water sanitation and hygiene project, for improving the child mortality in rural communities. And but we are aware that we need to work with other stakeholders for making sure that we arrive to the targets of the project. So we've been working with water committees, with families and the schools, so that students learn to use those indicators for outputs, for outcomes, change indicators, and impact indicator for the specific objective. So let me share with you the Excel which we use with them. Why Excel? Well, if you go to the most small local communities or municipalities in the developing countries, you will see that we don't have many sophisticated packets or programs. So you find usually Word, Excel, and PowerPoint in this location. So it's good to have these simple tools in order for the local communities to use them later on when we leave the project and the area. And here in this Excel sheet, what we have built after having the planning tools like timetable, personal chart, budget, the log frame, etc. We simulate the advance of the project for a period of 1 year. We have the target population here, the information of the target populations. We have in the lower part, the indicators which we want to monitor during this exercise. And what we teach the students is how to include in the SDGs indicators and resilience indicators as well. Here, to make it shorter, I have included, or we have included the indicator number 1 of the SDG 6, because this is a WASH project, and it says that all populations should have access to a water service. So we are including this in the monitoring process, as well the resilience indicator that teachers are teaching at the school, in the school with the school children, as well to the families, those issues of disaster risk reduction I mentioned, like preparedness, response, and early recovery. So we follow this exercise here. That is a monitoring tool for monthly monitoring of process indicators. We monitor the products every 2 months, and every 3 months the change indicators, because you won't measure change indicators every week, for example, right? So we finish the period of 1 year, and we see if they have achieved the targets they wanted to achieve. For example, you can see here that the indicator, this indicator of the SDG had reached only a level of 3, which is reflected in the executive report, which is 1-page executive report, where you have the results, the final results of the main indicators for the outcomes for the products, as well the systematization curves, which show much easier how those indicators have been improved. That's what is the exercise, and we take 120 hours, academic hours. That is a 1 semester, 6 hours per week, 20 weeks. That's more or less our program. Thank you very much. I don't know if you have some questions.
Thank you.
I will stop sharing the.
Dr. Francisco Guachalla from the audience.
Thank you very much.
Questions on Zoom? Do we have any questions from our audience? I have one question.
Goals are goals. How do they link in the indicator system with what's happening in reality or in the local level? Same thing with the earlier conversation about the cancer registry. Does it link with another registry of risks to cancer? So I think that's just a general point that, you know, it's very difficult to get data and to get it working, but also making the connection across different data points or different data sources is quite important. And somebody's going to speak about using big data. So I hope that you also touch on that. I'm not sure that you go as far, but it's a point for reflection. You know, there's all these different data sets and how they connect or don't. And should we be using that as part of our building of accountability systems?
Dr. Francisco, if you want to answer.
Yeah, thank you for the question. It's very real. We started this system in 1996, actually, working for UNICEF and for Catholic Relief Services and International Plan. And we had a list of a long list of indicators which were not realistic at the moment to measure them at the local level. And discussing with the authorities, with the leaders, as well with the project team, we've been summarizing the main indicators which were more realistic to measure, and the team didn't need too much time to measure them so that they could report the advances every week. And we systematized that in order to help them to take a short period of time to report those advances every week, every month, or every 3 months, according to the level of indicators they have. The change indicators for outcomes or product indicators for the outputs. No, I am aware about the difficulties that you are mentioning. When we have too many indicators, they are not manageable, and the people tend to take too much time at the desk instead of working with the people at the community, which is more important in my opinion.